10 million children in the world die each year, and a lot of those are in poor countries, and I wanted to go and work in a place where I'd be having perhaps a small impact and be involved in teaching people who are going to be doing that, so after I leave somebody else can do it.
You certainly have to be adaptable to work in Malawi. You have to adapt your skills, and it can be done. I'm Pam Wilson. I'm working at Malawi College of Health Science, Somba campus. I'm a clinical nurse tutor and classroom teacher.
I'm Olly Jeffries. I'm a doctor training in paediatrics. I went to medical school in Edinburgh and have been working in Bristol for the last few years before going to Malawi.
There is a problem with retention of trained nurses in Malawi. They've tended to leave the profession to work abroad or work with NGOs in other health areas within Malawi because they're paid more. The impact of the nurses leaving means that there's not enough trained staff for the number of patients, and it does have an impact on the care that is given. I worked in one of the district hospitals here in Malawi in the paediatric unit, which had 100 children with only 6 or 7 cots.
If one nurse is looking after 80 patients, they might be spending all their time just giving medicines. So they do one lot of giving medicines, and then it's time to start the next lot. And they don't really have much time to identify children when they become sick.
There's a lack of basic equipment like a drip stand, for example. You had to tie up the fluids against the wall or on windows.
There were so many of my existing skills I think were called upon and I had to develop whilst in Malawi. My clinical skills, having to think without the aid of the investigations that I'm used to, having to make clinical judgments and treatment decisions without necessarily the treatments and drugs that I'm used to. Dealing with very sick children, so I developed many skills, particularly in the sort of initial management of children who are needing resuscitation.
The skills that I brought with me to Malawi that have been really helpful to me is that at home I'm a district nurse, a community nurse. I'm able to adapt my nursing skills to being able to work with very little resources. When I'm clinical instructor, I'm following the students out into the clinical placement area and teaching in the wards.
Of course, Pam has helped us a lot. We do make mistakes sometimes, but she waits for you, she calls you aside. With Pam, it has been a very good experience.
I've learned to prepare lectures.
I was involved in actually organising and running the 5th year medical students teaching.
Here I'm teaching in a classroom up to 72 students at a time.
And their teaching involved tutorials, bedside teaching, ward rounds, going to clinics. I've had a huge amount of clinical exposure, which someone who just stayed in this country would never hope to achieve. I think if you're involved in teaching people to become doctors, then there's no question that it's going to be sustainable.
We are making a lasting impact because the students I'm training now are going to be trained as hopefully I was trained.
I was in Malawi for just over a year and there are already people that I'm teaching who are working as doctors. There are another 40 students who I've been involved in teaching paediatrics who are going to be doctors within 6 months.
So what I would say to somebody who's considering applying is yes, apply, do it. You've got a lot to give.
If you're involved in some of the things that I was, that's only going to have a positive impact on your career. I had a very good time. I learnt a lot and I'd like to go back.